Hi again. This time I'm making a video from our field office in Kenya, where I've had the honor of working with our team here for the past 2 weeks. As part of that work, I've also been interviewing a number of our children with disabilities who have benefited from our program. And while we've heard great success stories, we've also heard about where they've come from and prior to our interventions, what their conditions were. One young girl told me that she actually was not able to spend time with children in her community because they thought that that her paralysis was contagious and that they would get it themselves. And another boy told me about some painful exorcisms that he underwent at the hands of a traditional healer who thought his deafness was caused by a demon. So these children have stories to tell, and they are examples of many people with disabilities around the world who are struggling to find their place in the world and who are struggling to even access medical care and education. The global statistics say that there are actually 15% of the population living with a disability at this time, and in Kilifi County, Kenya, that translates to about 120,000 children with disabilities. Among those, just 108,000 are in school, and 84,000 have been orphaned, most of the times because of their disability. In order to address these issues, we have started a training for religious leaders. We have 3 different workshops, one for pastors, one for traditional healers, and one for Muslim imams. We're in the early stage of implementation with the pastors and traditional healers, and we're still designing the Muslim imams workshop. The trainings are evidence-based. They're based on a lot of global data that shows the influence that religious leaders have on the health behavior and attitudes of people around the world, and especially in sub-Saharan Africa. And we see this evidence supported by a lot of movements that are happening within Kenya. For example, the Ministry of Health in 2017 said that as part of their 5-year strategic plan, they were going to be working with traditional healers to address common health issues in their communities, such as cancer. So they're really engaging these leaders at a national level. And so we started to do the same thing 3 years ago, and we have great evidence from our programs that it is working. That after these trainings, in just 3 years, these traditional healers and pastors have been able to identify thousands of children with disabilities and get them access to schooling and to urgently needed medical care. The solutions, although they're implemented by a team of both Americans and Kenyans, are really locally developed and locally responsible. The idea for these trainings came from our pastor communities in Kenya. They asked for more training on disability, how they could get it, how they could start spreading the word about what disability is, and how their communities could do more to help people with disabilities. And then after we started designing the trainings, we developed an advisory committee that has really helped us to refine the trainings and the assessment tools so that we really are locally responsible, but also culturally relevant and appropriate for the context in which these tools are being used. This team of 30 professionals are both pastors, Muslim imams, and traditional healers who are all Kenyan and who have been working in this country for many years in their religious sects. The outcomes that we're measuring at this point are 5. We're looking at the number of children who have been identified by these leaders after they go through our training. Then we're looking at how many of these children have been referred for medical care and for education. And then we're looking at how many parent support groups have been formed for families impacted by disability, and how many disability committees have been formed to help communities get sensitized about disability. So those are the outcomes that we're looking at this point, and our team is made up of 7 professionals at this point, 2 Americans and 5 Kenyans, and collectively we have over 100 years of experience in various fields related to this work, such as religion, disability, public health, assessment. 2 of the team members actually are living with disabilities themselves, one of whom is our founder, Cynthia Bauer. If we were to receive funding for this project, we would use it for 3 things. First, we need to build out that Muslim Imams workshop. We have a lot of work to do there still, and we are hoping that we can do more research and consult with experts if we have some funding behind us. We're also developing a training of trainers so that the pastors and imams that we've worked with can start training other religious leaders in their communities, and so that this workshop and its impact can spread more rapidly throughout Kenya. And finally, we want to enhance our monitoring and evaluation tools so that we have better measurements of what's working and what's not so that we can continue refining it. We believe that these changes will really help us to reach even more children with disability, potentially thousands in just 1 year. Thank you so much for considering us.